Okay, thank you, Dr. Sulab, for your interesting presentation regarding the Raman spectroscopy. I will move now to the third speaker, Prof. Alberto Salmon. He will give us a talk about the hair analysis in clinical and forensic toxicology. Prof. Salmon is an associated professor at the University of Turin. His research activity focuses on hair analysis with close attention to new psychoactive substances, NPS, and alcohol biomarkers. His major research interests to examine the diffusion of NPS in different times and different countries. He regularly appointed as an expert to provide assessment with the complex judicial cases on biological fluid, drug-facilitated crimes, and post-mortem investigation. He is the president of the European Workplace Drug Testing Society and member of most important scientific societies in the field. He co-edited a book about the hair analysis in clinical forensic toxicology and co-authored several peer-reviewed journal articles and plenary lectures at national and international scientific meetings. So I would like to welcome Prof. Salmon, and I will ask him to give us his interesting lecture.
Thank you very much for the introduction. Yes. And thank you for this opportunity. I'm very happy to be part of this conference and to make the acquaintance with the Saudi Society for Clinical Chemistry and to participate to this interesting meeting. I am located in Turin, which is northwest of Italy. And I am associate professor at the university, the Department of Chemistry, and I'm also collaborating with this laboratory in the picture, the Regional Anti-Doping Center, where I perform most of my research activity. In my presentation, I will try to give you an overview of hair analysis and to frame the basic concepts which are needed to understand the second part of my presentation, where I will try to show some examples of application and real cases. And obviously, I will finish with some comments and conclusion about the utility and the potency, powerness of hair analysis. Hair is the reference matrix for the investigation relative to drug intakes that happen weeks or even months before, and to recreate the history of the administration. This is possible because hair grows regularly and approximately 1 centimeter per month. And this is true only for scalp hair or head hair. Instead, no chronological information can be obtained from other hair samples, like, for example, body hair, like axillary hair or chest hair. The drug incorporation mechanism into the keratin matrix is not univocal, but is complex, and we can say that drugs are usually incorporated through bloodstream, through sweat, sebum, and external environment. Like for every analysis, the first step is the sampling. Usually the sampling is done in the vertex posterior region, because this is the region where there is the highest number of follicles and a limited variability of hair growth. Usually 1 or 2 or more, if there are more analyses to be performed, 1 or 2 locks of hair are collected, and each lock is usually a diameter of 0.5 centimeters. The hair sample can be stored in any dry cup or envelope, labeled, and shipped to any part of the world, because hair is stable. So the main advantage is probably that the sampling is non-invasive, and the main recommendation is to cut as close as possible to the scalp and parallel to it. After the sampling, there is always the analysis. And in this case, the analysis should detect the tiny amount in the range of nanogram or picogram per milligram of hair, tiny amounts of analyte which are trapped inside the hair. So also after a single intake of unknown psychoactive substances, we need to do the analysis and detect this amount. Therefore, we need a very performing analytical method, which can be untargeted or multi-targeted. The method must have extreme sensitivity and allow segmental analysis. I will show some examples in the next slides to better understand the significance of segmental analysis. So typically, the instrumentation is liquid chromatography coupled with mass spectrometry, better if it's a tandem mass spectrometry or high resolution mass spectrometry. So when we combine hair with the last technologies available, we are able to detect hundreds of drugs. We are able to update the method if a new drug is introduced into the black market, like it happens continuously today with the new drugs. We have extreme specificity, of course, and we have accurate quantification, very fast analysis because of the ultra-high performance liquid chromatography. And we have a wide period coverage. We can obtain several information even from one only sample. The parent drugs are usually the target analysis. This is helpful. I mean, this facilitates the analysis because there is no need to study the metabolism and look for new metabolites, because the parent drugs is usually the main target of the analysis. As I said, the sampling is non-invasive and non-embarrassing for the individual, so personnel of either sex can perform sampling. And as I said, the sample is highly stable and so can easily stored and transferred to the laboratory, no matter where the laboratory is in the world. And so there are several useful advantages. And for this reason, there are dozens of applications and hundreds of real cases that have been published in the literature and described in the literature. Of course, we cannot now detail all the situation, but I can recommend this book, not only because I co-edited, but it's because this is a very nice summary of all the situations in which hair analysis can be used. One of these, very typical in clinical and forensics, is the drug-facilitated crime or drug-facilitated sexual assault. Yes, I'm sorry, there is an echo coming from the microphone. I don't know if the support can do anything about it.
Doctor?
Yes? Okay, maybe it's over. Yeah. So I was saying that this is a typical situation in which hair analysis become very powerful because in these cases often urine and blood are not available, and so hair is the only possibility to isolate a period in which the drug was given or taken. But again, this is a very complex matter and we don't have time now to go into it. And again, this is a book that you can read if you want more information about it. Instead, I will try to show some examples where I'll try to highlight the importance of hair analysis. The first situation is the analysis of large population. As I told you before, in hair samples, the drugs are stable and remain detectable for months after use. So if you collect hundreds of samples from a population, you can investigate the drug diffusion among this population, and you therefore can obtain significant information about drug prevalence in the months prior to the collection. I have published several papers on this topic, especially with some colleagues from New York City, in which we investigated the drug use among electronic dance music party attendees, because of course this is a population at high risk for drug use. And we discovered that drug use is often underreported by the population, and we did so by comparing the self-reported use with high hair toxicology results. This was published, for example, in Clinical Toxicology, and again, I recommend that you read it if you're interested in this topic. But let's go into some real cases with some detail. In this case, we had an intoxication from drugs of abuse and new psychoactive substances. A 30-year-old male was admitted to the ER with a severe state of hallucination and agitation, tachycardia, and external body temperature pretty high. This was before COVID, of course. Metabolic acidosis was observed, and the patient was sedated with midazolam, diazepam, chlorphenamine, and haloperidol. And after 12 hours, the blood results were still very disbalanced. At the urine screening, we had the result of positive to amphetamine, cannabinoids, and benzodiazepine. And after blood confirmation with GCMS and LCMS, we saw the presence of midazolam, diazepam, and haloperidol, which were given at the hospital. THC, which was already detected by the urine screening, and of lormetazepam and difenidine, which were not detected by the preliminary analysis. Difenidine, if you do not know, is a new dissociative. And with the hair sample, we saw that the subject was a chronic user of several new drugs, PVP, MDPV, methoxyethamine, 4-fluoroamphetamine, methylone, and difenidine. So this was a useful information for the interpretation of the clinical picture. In this other case, we had a 49-year-old female nurse who was feeling various symptoms, including rigidity, drowsiness, and buccal dyskinesia in 3 different occasions, and so she was hospitalized 3 times in the previous 9 months. No, we didn't have blood of urine sample, we only had hair. And we did a segmental analysis, and we found that the segments corresponding to the hospitalization periods were all positive to haloperidol. And this was the evidence that the victim was repeatedly administered haloperidol. In this case, we had a 97-year-old woman hospitalized because of severe symptoms, including drowsiness, convulsion, pallor, and hematoma. As you can guess, there were abnormal values for coagulation parameters, and she was dismissed after a typical intravenous administration of vitamin K. But after 1 week, the woman was taken again to the emergency department because she was suffering the same symptoms. And so the blood sample was positive to difenacum, which is anticoagulant used as rodenticide. We collected the hair, we did the segmental analysis, and we found that only in the proximal segment, the sample was positive to difenacum and also to alpha-chloralose, which is, as you know, another rodenticide. So the conclusion was that the victim was administered difenacum in few isolated occurrences because of the low concentration in hair, but was repeatedly exposed to alpha-chloralose because of the high concentration. And this was the clear, it was the evidence again of a clear attempt of murder. Another examples come from anti-doping analysis. We have 3 situations here. A professional boxer positive in urine after an in-competition control to clostebol metabolite. A runner female positive to clostebol metabolite, and a young diver positive to clostebol metabolite. Clostebol is an anabolic steroid, which is also contained in some medication, quite common in Italy and in other few countries, because it is used and is approved for medical use as dermatological preparation. So it is often used to heal from damages to the skin, for example. We did hair analysis again, and we found in the boxer a low concentration of clostebol acetate. In the wife, who was actually using the cream to heal from a tattoo, she had a higher concentration. The runner had higher concentration, and the diver was negative to clostebol acetate. So we were able to offer an interpretation about the origin of the exposure and to the level of the exposure to clostebol. And so, you know, the diver and the boxer were cleared from doping use, and they did not get any sanction because hair was able to prove that they were only exposed accidentally to clostebol and not for doping purposes. I'm running out of time, but I'm also coming to my last example of application, which is very delicate, and this is in regard to children. Children can be exposed to drugs in utero during pregnancy. They can be sedated with drugs to keep them quiet. They can be sedated for sexual assault. They often ingest accidentally drugs if the drugs are present in their houses or apartments. They can also expose passively from the environment. In this case, we had a kid, a small boy, I think he was 11, if I remember well, 11 years old. He was taken from school dizzy and disoriented and taken to the hospital, and in blood, the laboratory found traces of a benzodiazepine, the lormetazepam. So we collected hair, and we did, again, a segmental analysis, and we found in the segments a different situation. In some segments, we found only lormetazepam without lorazepam, which you know is the metabolite of lormetazepam. And lormetazepam was at increasing concentration. Only in the first segment, the one corresponding to the hospitalization, we observed also the metabolite, lorazepam. So we concluded that in this case, the kid ingested a low quantity of lormetazepam, and this was also confirmed by the blood analysis. But in the other periods, he was only exposed from the environment to lormetazepam, possibly from the parents. This is part of the investigation, because the metabolite was not present. The second case, we had a very old girl hospitalized with severe coma state. She was taken to the intensive care, and after the administration of naloxone, she recovered. And in blood, it was found a very high concentration of methadone. The mother was actually under the therapy with methadone. She admitted the use of heroin since the 8th month of pregnancy. She was still breastfeeding until the 9th month of life of the kid, and both parents admitted use of heroin by smoking. Again, the hair analysis provided very, very useful information, because we saw that methadone was always present, but the metabolite was never present. And this is evidence of very strong external contamination coming from the environment, especially when the family lives in a very small place. We also saw morphine and 6-MAM, the other metabolite of heroin, in a pattern which is consistent again with external contamination. But still, we had to explain how the kid survived because of the very high concentration of methadone, which is potentially lethal. But the hair analysis showed that the kid was constantly exposed since she was born, but also probably also before, during pregnancy, to opioids. So she had probably developed a tolerance to opioid. And if you look at the literature, it's quite common to see that when parents or care foster parents are using drugs, the hair taken from kids and children is usually positive to drugs because of the environmental contamination. So in conclusion, hair analysis is an effective tool to evaluate the prevalence in a selected population of drugs, and ideally hair analysis can complement questionnaires in epidemiological surveys. Is ideal for a long-term monitoring, and with hair analysis we are able to detect changes in drug use over time, and guidelines are available. There are guidelines for collection and for analysis and for interpretation, but probably interpretation should be always offered by an experienced toxicologist. So I highly recommend hair sampling in all cases, and especially in unconventional cases. Hair must be collected by trained personnel, because I showed you the procedure, which is quite easy, but it's important that hair is properly collected. Otherwise, the interpretation based on the length of hair and the diagnostic frame can be completely altered. So hair analysis can shed light on complex cases, but always cooperation between clinical and forensic toxicologists is essential for a correct interpretation. All data must be combined to give a proper interpretation. Again, thank you for this opportunity. If you have ideas, comments, thoughts, questions, anything, you can write me an email or connect with me on the social media. I would also like to use my last minute to introduce you to the International Alliance of Clinical and Forensic Toxicologists, IACFT, which is a newborn society which is providing only virtual conferences in 7 different languages, including Arabic. So we hope to include more chemists, clinical chemists, forensic toxicologists in this alliance, and give more access and more opportunities to everyone in the world. Thank you again, and have a good night.